laboratory. They're also doing a lot of stuff. Chemoinformatics, bioinformatics, disease kind of oriented, disease-focused studies. So, and today I would like to talk about the AI-driven biomedicine. So it's kind of mainstream today, and especially from body cancer therapy to the blood-brain barrier and infectious diseases. And, I mean, I'm kind of working in the different research institutes and the universities. I got a full professor 3 years ago, and I also a part-time professor in Moscow and a visiting professor in Germany, in Würzburg. And here just outlook about the locations of the universities right where I'm right now doing the research. As you can see here, this is the Sechenov University in Moscow. It's a kind of old building where people in the past were doing the experiments, like Pavlov, doing the physiology, Sechenov, and Nobel Prize laureates. And my office located on the second floor, and it's just very nice to have a rest close to the water. And so right now we are trying to do also a lot of things on artificial intelligence. It's a kind of mainstream, and people are building new labs and the kind of research center. We are calling it AI and biomedical research. The other location is in Würzburg, also kind of very old building here. It's close to the Medical University Hospital, where we have a lot of medical students passing around. And if you can see here, this is the building for the surgery, where they did a lot of experiments in the past, performing vasectomy, performing some heart surgery here. And we have a new building here. I'm not sure whether the site is good, but it's a kind of a new center here where we do a lot of modern research, like cell biology, molecular biology, biophysics, and mostly the web lab experiments. Less bioinformatics and chemoinformatics, but mostly the lab experiments. The other building is in Taiwan. I was also working in Taiwan. This is China Medical University Hospital. I was doing a lot of clinical-oriented research with my Taiwanese colleagues. Professor Su, who is the director of the nutritional psychiatry. So they're putting a lot of money in the research on some drugs, let's say, food supplements, how to treat the depression. So this is their field. And the last but not least, the building in St. Petersburg. This is the ITMO University, also kind of a castle, a small castle. And the historical building with great history, close to 200 years or so, where right now I'm also, like, my office is located, and we are mostly focusing on some physics-based research. I mean, the ITMO is known for physics and optics, precise physics and optics research institution. And right now I have a number of publications close to 160. Most of them they are in Q1, and 70–80% of all publications I am participating as a first author or corresponding author. I also have very strong collaborations with different countries. Of course, Germany, Taiwan, Italy. I was doing PhD studies in Italy, so I have very close connections with Italy, and some European universities like Hungary, like in Eastern Europe as well, and less in China, but we are improving also in this direction, because right now Russia is very well oriented to find very strong collaborations with China, and they are building like Chinese-Russian collaboration centers together with Germans. So they are now also trying trying to establish a very good cooperation with Chinese university, for instance, with the universities in Beijing University, Tsinghua University. They right now have center in Würzburg, cooperation and collaboration center in Würzburg, and one is in Munich. This is a Munich Technical University, the top university in Germany, and they are right now strongly collaborating with Beijing University. So they're trying to improve science together. They're going in this direction. And this is kind of very funny, I think. I just got a board developing some AI-oriented pipeline. This is my postdoc from Africa, a very talented student. He's also very prolific. We publish it together in the Heidelberg Vector journals. And my colleague, Professor Prof, he's well-known oncologist, mostly doing clinical trials, treating patients. So he's mostly affiliated to some hospitals, some university hospitals in St. Petersburg, St. Petersburg Medical University Hospital. So he's the chief director of the oncology department, and we are very strongly working with oncologists to develop some cutting-edge therapies to combat the cancer using chemoinformatics, bioinformatics, biomedical informatics, and also some experimental data and some mathematics as well. So this is this is the kind of outlook of my research and the AI